Question number 2, Anna Sarwar.
President Officer, can I start by joining others in thanking you for your service and wishing you all the best for whatever comes next, although I fully expect over the next 10 months you'll continue to hold us to proper decorum in the Parliament and tell us off from time to time in that period too. Presiding Officer, just this week, house building at its lowest level since 2012. Sexual violence and domestic abuse rising. Delayed discharge at a record high. Almost 1 in 3 Scots forced to go private to get healthcare, and cancer waiting times the worst on record. Has the guy that claimed to steady the ship now become the captain of the Titanic?
First Minister.
President Officer, Mr Sarwar raises a number of important issues, and let me just go through a number of those. On housing, the Government, of course, has put in place a budget provision for this year, which has seen a significant increase in housing investment, which will assist us in the affordable housing plans, building on the fact that in Scotland we've built 47% more affordable houses per head of population than in England, and 73% more than in Labour-run Wales. So that will help us. And of course, that's in a budget that Mr Sarwar never voted for. On the issues in relation to delayed discharge, 97% of patients are discharged from hospital without any delay whatsoever, and delayed discharge is falling. On recorded crime is broadly stable with where it has been. The increase of reporting of sexual crime is because more people are prepared to come forward, because this government is prepared to pursue sexual crime and bring offenders to account. And on cancer treatment, as I've explained to Mr Finlay, the government is focused on improving waiting times and reducing the waits that individuals have. So this government is absolutely focused on the priorities of the people of Scotland, and that's the leadership that I deliver to ensure that's the case.
Anna Sarwar.
The fact of the matter is John Swinney and the SNP aren't working, and Scots can see that. Our NHS is fighting for survival under John Swinney, and Scots are paying the price for his incompetence. Just this week we heard the case of Gerard McBride, who has waited 76 weeks for hip and knee surgery despite crippling osteoarthritis. We heard from Alison, a mum, who told the BBC that she had to pay £4,500 for private cataract surgery. She said, and I quote, "I would have gone blind before the NHS would have seen me." And we heard from Elizabeth, who had to spend £18,000 of her own savings for a hip operation due to long waits on the NHS. This is the price Scots are paying for SNP failure. And the situation is so bad that Dr Ian Kennedy of the BMA has said that the NHS is dying before our eyes. Isn't this a damning indictment of John Swinney and the SNP, who are destroying our NHS?
First Minister.
President Officer, the Government is taking the steps to make sure that the NHS is able to have the capacity and the resources to deliver on people's expectations and their needs. So, to give 2 examples of that, the first is that we've put in place a record financial settlement for the National Health Service, which the Labour Party could not bring itself to vote for in the recent budget. And secondly, in April 2024, we promised to put in place an additional 64,000 appointments and procedures by the end of March 2025, and we exceeded that target, delivering 105,500 additional procedures in the first year of my term in office as First Minister. So what this government will do is that we will focus on meeting the needs of the people of Scotland, put the money in place to do so, not duck the responsibilities as Mr Sarwar has done, and make sure people get the treatment that they require.
Anna Sarwar.
This is a failing First Minister in a failing SNP government. John Swinney took personal responsibility for tackling the crisis in Scotland's NHS, and now things are getting worse. Waiting lists up, thousands more Scots forced to go private, and cancer waiting times the worst they have ever been. And as the crisis in our NHS deepens, where was the Health Secretary this week? in Japan lecturing on digital healthcare while he can't even sort an NHS app at home. And while he was away, we did get a rare moment of candour from Public Health Minister Jenny Minto. When asked about the worst cancer waiting times on record, she said to STV, "Are people losing their lives due to later diagnosis? Yes, they may well be." An SNP minister admitting that SNP failure is costing lives. So what does John Swinney say to the families left picking up the pieces of losing a loved one too soon?
First Minister.
What I would say to families is that the government is doing all that it possibly can do to make sure that we have in place services that meet the needs of individuals. And the reassurance I would give them is this. When individuals are identified as requiring treatment, the median waiting time for people getting that treatment is 3 days. That means that the majority of patients are getting the urgent intervention within a matter of 3 days after their assessment. That is what the Scottish Government is doing. Now, I accept that on the 62-day target, we have not got the performance around the country that we require to have. But we know from individual parts of the country that those services can be delivered. And what the Health Secretary and I are focused on doing is making sure that in every single part of the country, people can rely on the National Health Service being there when they require it. That's the commitment I give to Parliament, and that's what we're focused on delivering.